Welcome to the Dr. Joe Show.
Yeah. So nice to see everyone. We've been doing all these pre-records before, folks, and now we're back live on the air. It is such a treat to see everyone here. Mark, how you doing?
Doing well, Dr. Joe. How you doing, buddy?
I'm
Good to see
doing.
you.
It's good to see you too. And it's the new year, 2023. I hope this is really a year of healing. That's really what I think we need more than anything. Tom, what about you? How's your new year going these last 5 days?
I'm feeling pretty good about this year. 2022 was kind of like the loading screen of years. For me, it was.
Go ahead. Tell me about that.
It wasn't my year. I mean, it wasn't there. I can't point to anything exactly except for, I guess, catching COVID and having a heart problem for a few months. I'm looking forward to this year. I'll say that much.
I am glad to hear that. I am also looking forward to this year because last year was such an interesting time. 2022, still in the midst of COVID, and yet still all these continued difficulties going on with the division in our world. This intense one in group versus another out group, and a whole bunch of cortisol going on throughout the entire world. We can talk about the cortisol response later, but we have people here tonight who I am so looking forward to talking with them and hearing their insights, sharing their stories. One is a return guest. Another is somebody that I saw at a remarkable conference at Boston Children's Hospital. But Tom, could you please introduce our guest for tonight?
Absolutely, Dr. Joe. So returning to the Dr. Joe Show, we have Dr. Angela Crutchfield. For those who may not remember, I can't imagine. Angela Crutchfield is owner of Peace Unlimited LLC, an executive leadership coaching, lifestyle coaching, and transformational HR consulting practice. She served as Vice Chancellor for Talent and Chief Diversity Officer for the University of Mass Dartmouth and currently serves as Consultative Diversity and Inclusion Director for Riverside Community Care in Boston.
Yes.
And joining her, we have Dr. Kevin M. Simon, the inaugural Chief Behavioral Health Officer for the City of Boston. He is a Harvard-trained board-certified psychiatrist, serves as attending psychiatrist at Boston Children's Hospital, an instructor in psychiatry at Harvard Medical School, and a Commonwealth Fund Fellow in Health Policy at Harvard University, as well as the medical director of Wayside Youth and Family Support Network. Clinically, he practices as a child, adolescent, and adult psychiatrist and addiction medicine specialist caring for youth, young adults, and families throughout the Adolescent Substance Use and Addiction Program at Boston Children's Hospital. As a researcher, Dr. Simon has received federal funding for work focused on the intersections of mental health, substance use, and justice involvement. Welcome, welcome.
Welcome to both of you. Thank you so much for being here tonight.
Happy to be here.
I'm so glad. Let me first welcome you back, Dr. Angela. It's always a pleasure to have you here. What's been going on with you over the last year?
Oh goodness, lots of things. I do want to make two small corrections for that intro. My business is Crutchfield Group LLC, a little bit different. And also, I think you had a slight correction on that title. It's Vice President for Diversity and Inclusion for Riverside. So
yes, she is Vice President.
No worries.
And
things have been good. Things have been busy. Things have been concerning. Things have been in need of the work that we do in this space of diversity and inclusion. And I think we have a lot of work to do in this space and helping people to be more thoughtful and more open to addressing their own individual concerns that would ultimately impact other people. If people aren't thinking about what I can do differently, then the mindset isn't in the right space. So a lot of those types of things going on, Dr. Joe, just trying to stay busy in that space to do what I can to make the world a better place.
Yeah. And we have to do this together. This isn't something we do alone. Have to be in this together. So I appreciate that. And Dr. Simon, it's wonderful having you here. Like I said, when I first met you, and the only time I met you was at that incredible conference at Boston Children's Hospital that you were given. Tell me what's going on with you. Can you tell people a little bit about yourself and what the talk was that you gave to us that day?
Yeah, so one, thanks, Tom, for reading the bio. But I'm originally from Brooklyn, New York. Parents still live there. My parents, they're from Haiti. Let me turn off my email. And I've been in Boston now since 2018. We moved here. My wife and I coming from Atlanta. But the talk that I was giving at the Children's Behavioral Health Summit was in reference to health equity and behavioral health and the intersection, and kind of looking at it from a developmental perspective. So, kind of talking about little kiddos, 4 or 5 year olds, all the way up into what I like to call emerging adults. In so much as although you turn 18, you're legally an adult, many times you're still emerging because you're still dependent on mom and dad. But yeah, the talk was, the conference itself was about the changing landscape of behavioral health care and legislation that's passed, work that organization Angela, Dr. Crutchfield is associated with, is doing. And like literally today is the 5th, on the 3rd in our state, several what we'd call like community behavioral health centers, went quote unquote live. So just thinking about, we have new programming, what that's supposed to look like if we're really suggesting that we're trying to make a difference. So that's what the premise of the talk was.
And just full disclosure, so as the Chief Medical Officer of Riverside Community Care, we actually have been granted 2 of those CBHCs, Community Behavioral Health, one in Milford and one in Norwood. And so for those listeners who are in Massachusetts, if you are a Mass Health recipient, you have access to arguably a new and yet old way of doing things, because it's returning back to the community. We're trying to avoid people getting into hospitals. We're trying to avoid the long lines in emergency rooms, which are so detrimental. But there's still that disparity, and that's part of what I wanted to really talk about. That the part that is still baffling to me, and I know it shouldn't be, but help me, we're still seeing these disparities in access to care, in the result of not having access, in how folks are viewing themselves, because other people can be mean and cruel. Right. So how do you want to, Dr. Salmon, can you just maybe talk a bit about, there was a paper that you were co-author on back in 2022, Pediatrics, Disparities in Pediatric Mental and Behavioral Health Conditions. And some of the data was mind-blowing. Can you talk a little bit about that first?
Yeah, unfortunately, no matter the kind of category we look at, whether it's access to care, or even when people get into care, who quote unquote completes care, the type of care people get when they're in quote unquote care, when we start to what we'd say is control for other, multiple factors, seemingly if there's a melanin or brown hue to a patient or a family, they're getting, unfortunately, the worst of outcomes. So in terms of access, pre-pandemic, in the pandemic, post-pandemic, in terms of who gets in to see the provider, if you're Black, Brown, Latino, harder chance. And, that's both historical for a variety of reasons. There's appropriate historical mistrust of, medicine in certain cultures. And so even as a provider of color, I recognize that I am also representative of that entity, right? So even when I engage with families, if it's African Caribbean or Afro diaspora, I have to engage in a certain way that might be different. And again, everyone is different, so you should be using like your cultural humility and nuance. But yeah, access, you have mass health. Certain providers may not take mass health, and then the places that do, because of differences in funding allocation, right? You have some clinics that need to see, in traditional outpatient setting, need to see 25 patients, per day, which is in our particular field rather difficult. It's different than a surgeon who's coming in and looking at MRIs and saying, "Oh, yep, we're gonna, do this for the ACL." That might be a very targeted conversation, but the notion of a 20-minute, 25-minute psychiatric visit or behavioral health visit is kind of mind blowing, and that's why I like when I'm at Children's, the clinic that we have is an open access, given the conditions, and each session's an hour.
Nice.
But we're afforded that because of mixed payment model. But back to the
It's let me just cut in for a sec, because it is also about access.
yes.
And one of the things that we do here is we give our sponsors access to the time that it takes for them to share their things, not 20 minutes, but a couple of minutes. So with that, Larry, let's take a commercial break and give our sponsors some access to our audience. We'll be right back with the Dr. Joe Show.
Welcome back to the Dr. Joe Show, here tonight with Doctors Angela Crutchfield and Kevin Simon.
Yeah. Thank you so much for being here, Tom. Nicely done. So we're talking about access. We're talking about how long it takes for a mental health visit. I mean, we have sometimes 15 minutes to do a med visit, which is nuts. But I want to just ask you, Dr. Angela, given what you're doing now with Riverside, and I'd like to think there's a commitment to diversity and inclusion. What do you think? Are we making some positive changes? We have these new community behavioral health centers. What do you think?
I think we are, but I want to take a step back just to go a little bit of kind of backtrack on what we just heard. We jumped to this place of, hey, we want to make sure we have this in place, do this. Those things are great, but no one wants to have the conversations that have put us in this position where there are disparities. So those barriers have been there, and there are a number of them, especially when I think about the Black community in America, as well as other populations of people of color in particular. When we think about it, do they have even the understanding, the education, the openness to even receive those type of services? We got to deal with that because of the trauma that people have experienced in this country for so long. There's a lack of trust, right? There's also a lack of Black therapists. I mean, I think it's so important that we have, Dr. Simon, it's important that we have therapists that look like the people who need the services, because that cultural stigma within the community impacts how people even approach trying to get the needed services. So even if we work hard and we duplicate, Dr. Simon over and over and over again, that's wonderful, but are people still going to be a little bit leery based on the historical experiences that we must actually be open to talking about, because we have experienced so much that has negatively impact people? I mean, I think about, for example, growing up in the South, you didn't hear people talk about people who look like me having mental health challenges. That wasn't even a conversation, right? Now that is a common conversation. In the past, it would be, oh, that person's just a little special. No, that's just Uncle Joe. We know how Uncle Joe can be, right? We would hear that, and it would just be that person is pushed to the side. As a child, was it addressed as it should have been? No. So having Dr. Simon doing the things that he's doing right now is vital, because those young people during my growing up years, my youth, became adults, and nobody helped them. So then as adults, what do we see? The things that are going on today, where we're seeing
our internet service providers know when to leave us in suspense.
I'm telling you, that's like just
But she's
hold on. You froze right at a critical moment. So
I did. Oh.
we're about having the conversation, and
where are we seeing it?
Yeah, well, I mean, again, I probably said a lot of good stuff. I don't even remember what I said, but it was good.
Yeah.
But again, having those conversations and really trying to address the concerns that put us where we are. Having people like Dr. Simon today is awesome, but are we talking about and dealing with what we have had to deal with so that we don't repeat these issues? We've got to change the culture. We've got to change the approach to how we help people. I don't know if you mentioned, you heard me mention about growing up in the South and people not being cared for. If they weren't getting that treatment then, that passes on from generation to generation. So people across the generation still are leery or still have that stigma, that cultural stigmatism related to, hey, Black people have mental health problems? No, we don't. No. It's like a taboo topic. So those are just some additional thoughts to think about.
Yeah, there's this.
Go on, Tom.
But yeah, it's just there's this weird approach of society saying like there's a brick wall between yesterday and today, where we shouldn't be ray tracing our steps. Like I'm a history guy, and I don't love the story, but hearing about the city planning of New York City, how so many overpasses were, this is just one example, were made of a certain height so that buses couldn't get through, so that people of lower income couldn't reach certain clinics or parks or what have you. And it doesn't say anything explicit, but why it was like this was like the 30s and 40s.
Yeah. So I mean, the infrastructure, the disparities in housing, the disparities in just education, all of those things contribute to the disparities in mental health. It's all connected. It's about us really putting forth effort to come up with a comprehensive approach that is a deeper dive to address the systemic or systematic issues that are in existence. I think that's where the heavy lift it needs to take place.
Dr. Simon, are you experiencing that at Children's?
So it was very interesting in terms of both Tom and Dr. Crutchfield's point in reference to the historical nature, right? So in one way, we're in a good space in the Commonwealth in that there's been, legislation passed and funding is available. Yet at the same time, with the arrival of, programs, there'll be challenges in so much as, well, the workforce doesn't just there aren't, clinical social workers just hiding behind bushes.
Right.
They're ready to work 24/7 as some of these things are supposed to be. So there is investment in, the pipeline and getting it up. But, if that investment actually was a decade before or 2 decades before, we may not be in the situation that we're actively in. Again, in terms of who seeks the care, it becomes particularly challenging. I know I've seen this. I hear about a family and they're like, oh, they're Cape Verdean. And it's like, okay, I might be able to find a provider who's brown.
Yeah.
But now we need Cape Verdean language and say, okay, so we recognize how diverse we all are. And earlier, Dr. Joe, you mentioned, why is it still happening? And, when I'm teaching, I have to remind students, I'm like, we're all people who happen to end up in certain professions, but who you were long before you put on a coat or were in a clinic, you were bred and raised to have certain types of values. And so when I'm in the ED and I see a patient who is Black or brown, it's not uncommon for them to be adultified. It's like, no, he's not 18, he's actually 16. It's not uncommon to get a referral and this description, behavioral dysregulation, but is it really behavioral dysregulation or is it like unmanaged ADHD? And so sometimes it's in terms of taking a step back. It's something that we have to do often, and particularly in our field, where a lot of description, right, is utilized to inform how we operate in terms of levels of care, types of treatment. I have a clinical anecdote. I was on call. A nurse practitioner called me to the ED, and I happened to be in the hospital. So I went to ED, and then a neurodiverse youth with a helmet on, and suggested that he's really hitting himself, hitting people. And I went in the room, and Afro-Latina mom didn't speak English, and I just put my hands on where he was hitting, and he moved my hand out the way. I was like, okay, so he's not like actually trying to hit me. And I was like, okay, he wants something, but he's not verbal. So we just got to think about, okay, water, chips, let's just bring stuff. And eventually he devoured some food and was like, okay, he was hungry. But that same behavior the day before actually resulted in inappropriate medication management. So being able to slow down to speed up is very common in mental health. It's like, actually, if you just slow down, the picture might become clearer, for us all.
I could not agree more. I mean, we're talking the same language in this, all of us, because an anecdote I had was once I was on call in an inpatient psych hospital, and it was a code blue, right? Which means somebody's going to get restrained. You need to run to the unit. I run to the unit, and there's this guy he's going to attack people. He's so angry. And I just said to him, so hold on, what's going on here? He says, you're just going to restrain me. You're just going to give me an injection, restrain me. And I said to him, are you a lumper? I said, what do you mean? I said, well, you don't know me from anything. You've just lumped me in, probably with all the other people that you've ever met in psychiatry. But I'm just really interested in what's going on. What are you so angry about? And he was like, what? And we got to talk about it, rather than just assume something. So, I mean, the only thing that I assume is that our sponsors really do have something that they want to say. So that's my next assumption, is that we will take a commercial break, let our sponsors tell us what's going on. Larry, we'll be right back with the Dr. Joe Show.
And we're back with the Dr. Joe Show with Dr. Kevin Simon and returning all-star guest, Dr. Angela Crutchfield, talking about a very important topic, disparity in mental health treatment. Yeah. Dr. Joe?
Yeah. And not just the access, but the way we're perceiving people and how we are so dismissive of so many people. Dr. Crutchfield, can you tell us a little bit more about your growing up experiences and what you saw and how it has influenced the work that you're doing today?
Yeah, I can, but can I share one quick thing though, based on?
Of course, absolutely.
I think, I am not a clinician. However, I am a doctor of the workplace, a doctor of people. I understand all of those different components. And one thing that I think we have to remember, even in the service that's being provided to people who are in need of service, we've got to think about advocacy, making sure that they have that opportunity to advocate on behalf of themselves. And I think that connects to a theory that I use quite often in training leaders, understanding the platinum rule. And that is treat people the way they want to be treated. Golden rule is great. Treat people the way I would want to be treated. That sounds good. That's great. But if I take me out of the equation and give that space, that safe space for people to ask for that catch up, right? And you got paid a lot of money to give somebody some ketchup, and that's an okay thing. But when you really think about it, the simplicity of that should have happened at a much earlier point in any interaction and conversation that took place. We have to remember that we are dealing with human beings, even in those clinical settings. And I think that the examples that you shared, Dr. Simon, speak volumes to your thought process of saying, hey, wait, let's just peel this back. Let's just peel this back and be more thoughtful. So, for me as a person growing up in the South, based on your question, Dr. Joe, it gave me amazing insight into the experiences of being a Black person in America. And I'm not trying to represent every single Black person because I can't. I cannot represent every minority group, but I can represent myself, and I can represent those who I know fit the mold of my experiences. And I think we have to, as I said in the beginning, we've got to look deeper. So there's a deeper, I would call it a deeper root to what we see in modern day disparities. And this isn't new. We're not in a new place of disparities. We're just in a new place of where it's showing up. So the history, as I said, of our country, it's a bedrock of racial and ethnic disparities that have manifested to many ways, including behavioral health disparities, right? So the root has grown, and the trunk of that tree has these extensions now, and they extend into healthcare, they extend into the workplace, they extend into housing, they extend into public services, the infrastructures in our cities, education. All of those things have been impacted, and that is where the work has to be done, so that when we have that touch point with that patient, that client, that touch point is going to be received in the right way, because people will know that the work has been done to address the system, and they are comfortable with receiving the care. And one last thing, we've got to do more in that space of equipping younger people who look like myself, who look like Dr. Simon, who look like those of us who fit these marginalized groups, so that they can be trained and tooled up to do the needed work, so that people feel comfortable walking through the door of a healthcare provider's office and seeing someone who looks like them, and they feel like, okay, this person is going to get it. They're going to understand. I'll give you one last quick example. My son, and I don't know if I used this example once before, I've used this, I talk so much, I don't know. But, my son, and Dr. Joe, my son, have gotten to know my son well. My son, at a younger age, needed to see a dermatologist for something. And I was searching, trying to find a dermatologist, and I refused to take my son to a Caucasian dermatologist. And that's not ugly, that's not nasty. I just know the skin of my son is going to be different than what this person probably would and could acknowledge and treat effectively. So I was able to find a Black dermatologist, and it really, honestly, it made my day. The day I was able to find this person, I had to search. I had to dig deep to find her, and it was the best thing ever, because someone else who gave me some advice, who was a medical professional, gave me some incorrect information as it related to what was going on with my son, and had seen my son, knew all of the things that I mentioned. And going to this provider, I was able to get exactly what he needed. And that, to me, is an example of why we've got to do more in this space of educating and helping people understand that there are opportunities in the behavioral health space for services, roles, opportunities to be able to be a value add to the effort to end the disparities.
Yeah, and as you were talking about the root, and this sometimes I have to challenge funders. When we think about at least youth behavioral health and quote unquote resolving the problem or improving it, you know, there are a lot of spaces at therapeutic landscapes that people can be in, that are therapeutic, that are not clinic. And oftentimes the evidence showed that people would prefer to engage in other normative activities like dance, art. Yet it's interesting when you, at least the conversation I may have, where I'm suggesting, yes, maybe we need to, you know, alert the dance studio or alert the, you know, art museum, that this funding could be utilized in a way that promotes positive behavioral health. And sometimes it's somehow frowned upon, but it's like the answer can't come from the clinic. People live outside and experience things outside, right? Live, work, and play, social determinants of health. Yet there is, and again, I'm a physician, rightfully, so but there is an emphasis on what happens in our space rather than what happens outside of our space, which is where people actually are more often. Again, when we think about youth, particularly, it's like if I could get somebody into a soccer club or just some extracurricular activity, that's going to be probably more beneficial on a day-to-day activity than once a week, once a month. But you know, the way our system is, we tend not to emphasize the preventative aspects, but then we ask the question of why are the things the way they are?
At some point, we can continue to talk about how we can merge the arts and what we're doing in terms of our therapies. But the image that comes to mind for me was inpatient psychiatry again. What I would tell patients is, if you break your leg, you go to the emergency room, they take an x-ray, they figure out where the break is, they put a cast around your leg, maybe they keep you overnight, but they send you home with a broken leg and a cast. And the healing is going to be happening at home in your community. That's what inpatient psychiatry is. We figure out very quickly what's going on. We put as many supports around the person as possible, but that person is going to go back to their community where the healing happens. And the more we can support the community effort, so the community is also aware of the stigma that goes along with mental health and substance use. And I'm just curious, how much is that stigma just another manifestation of what we do to each other all the time? Dr. Crutchfield?
Yeah, I think that stigma is huge. And I think within certain communities, that cultural stigma that surrounds mental health care is what puts those limits on people seeking the support that they need. And we've got to find ways to help people overcome the stigma of mental illness and challenges in that space, whatever the challenge may be, because we've got to get to a place where people view mental health just like any other aspect of health. We have our physical health, we have we go to the dentist, we go to the optometrist, we do all of these things, and it's okay if I can't, it's okay if I take my glasses off and I can't read if I have anything on my screen, I can't read it. That's okay. You need to go to the optometrist. You need to go to the eye doctor and get you some glasses. Nobody has a problem with that. But when people's vision of their internal selves and the challenges that they may face, when those things come up, nobody wants to have a conversation about it. It's no, we're not going to deal with that. We're not going to talk about that. We're not going to get the help that might be needed. So it's really important that we can find that space. I mean, there are many, opportunities for learning and education in this area, because again, there's such a lack of awareness in our community, specifically our communities of color, that cultural stigma continues to grow, because that's what people hear. It becomes more, this is what I hear and what I experience in my community, versus understanding and knowing that it's okay to find yourself having mental health challenges, and that overcoming that stigma is what we want to make sure we're working towards, because there are false beliefs. There's so many false beliefs, and people who have a lack of clarity. It's, I think, on those of us who are trying to do any work in this space of better understanding of diversity, equity, inclusion, belonging, all of these things that we're trying to do. We've got to do more, and we've got to engage others to help with that education and removing that cultural stigma for Black people and other marginalized groups regarding mental health care.
It is about inclusion. Um, the idea that people are excluded is still part of, unfortunately, our in-group versus out-group mentality. But one of the things that I know are included are our sponsors. And our sponsors not only are included, but they're welcomed. So with that in mind, we'll take our last commercial break. Larry, we'll be back with the Dr. Joe Show.
We are back with the Dr. Joe Show with Angela Crutchfield and Dr. Kevin Simon talking about mental health issues across the board.
So, Mark, what do you think about this? You've been listening. What are your thoughts on this?
Well, we've had a lot of shows about stigma and mental health, and I think the more we talk about it, the more people will talk about it, the more we can lift that stigma for all communities across the board, because mental health has been hush hush for way too long. And I think, we talk about COVID positives, right? Every once in a while, what came out of COVID that was actually positive. And I think people talking about mental health is a super positive, because the more people talk, the more people feel comfortable talking and sharing. And all of a sudden we start to let this stigma flow away and realize, wow, this is kind of normal. This is actually really normal. But I love the conversation that Angela and Dr. Simon are bringing to that comfort level, right? Because again, we have the stigma, but that stigma is real. Who do I talk to? Who am I comfortable talking to? Who am I comfortable talking with about this? And, Angela, you brought up a great analogy with the dermatologist, but I would imagine with mental health even more so. You're not going to understand me because you're not necessarily from my community. I need someone who's from my community who can understand where I'm coming from. And I guess to Dr. Simon, like, how did you find your way into this profession, and how can we make certain that there's more folks in this profession helping your community?
Yeah, and so in terms of the how, I guess I'd give an ode to my dad here. So day to day, he was a public school teacher in New York, and then after like 25 years, he went back to school for social work. But along the way, he was a deacon, or I guess he still is a deacon, and just how Catholicism in Haiti is more like a liberation theology kind of lens, which is to say that you are working towards and for the most disadvantaged, and his demeanor, stoicism is something that, like, just seeing it from a very early state probably taught me more than residencies or fellowship, in terms of how you actually like be with somebody. Because training is like, how do you talk at somebody sometimes, but for him it was about like accompaniment is the theory, in terms of I'm with you in this journey, right? And so sometimes in terms of the stigma, want to type a couple things together. So in terms of substance use in youth, the one, substance use itself is stigmatized, having it in youth is stigmatized, and something that we often see is the stigma existing from like the guardian or the parent in an unintentional way, right? Where they're part of the program and the parent wants like complete abstinence to be like the goal and the home run. And the kid could be back in school, passing classes, engage in treatment, meaning like not saying, hey, F Dr. Simon, still coming. And I have had many a parent like, why isn't this working? And I'm like, well, what do you mean why it's not working? But it's their own frustration at what they're mentalizing as what treatment and success looks like. And sometimes you have to take a step back and say, wait a minute, when we met, there were a laundry list of things that, he, she, they were engaged in. And they made a commitment to not do quote unquote pills. And they've kept to that. They said, hey, I'll come, and they've done that. So sometimes you see even the stigma get internalized because of what the family wants to represent themselves as out in the community, right? And so oftentimes we actually will struggle at times. There might be a news report about something we're doing, and it's like, oh, can you get a family? And it'll be a family that has done well. They're like, well, we don't want to put ourselves out there like that, even though they're doing well as a complete unit. The stigma's still there.
Yeah, that's societal pressure, and what people has set as a standard and a comparison of what is considered quote unquote normal, versus people looking at where they are in their own journeys and knowing that journey is a good thing. That's kind of what I'm hearing and what you're saying. I think that's a huge part of the problem too.
Yeah, when people or systems ask, what would it look like? How do you know a plan or a program is working in the behavioral health space? There are like individual clinical measures, but I think in terms of the disparity that we've been talking about, the measure that like is most important is engagement, which is to say, if the person showed up, that is better than them not showing up.
Right.
And oftentimes for a lot of communities, and particularly those that are underserved, is the not showing up, right? So if the person is not showing up and they should be getting Suboxone, well, that's not good that they're not showing up. If they're not showing up and they're kind of near the 8th session of CBT, well, that's not good. So, in terms of the measure that we really want to see as programs evolve is when you get someone plugged in, right? What are we doing to keep them plugged in? Because them being engaged is better than them not being engaged.
Right.
So that's just a point I wanted to make in terms of like how we think about it on a large scale, what success looks like.
Yeah, for me, because I also work with substance use folks, it's quality of life. It's not necessarily even sobriety or abstinence. It's what's your quality of life like? And so, to your point, Dr. Simon, they're going to school, they're engaged with your family, they're doing things. And okay, I'm not advocating that they're smoking weed, but on the other hand, it's not just harm reduction either. It's saying what's your quality of life like? And for a kid to be able to reflect on the difference in their quality of life based on where they were before they started and where they are now, it's huge for them to be able to reflect, because the kid's brain is not always able to think about the future in the same way that a grown-up's brain is. So it's little bits. It's good. We're talking about so much. I'd love to have you guys back to continue this, but we have a few minutes left tonight. So I just want to get into the IM approach just for a moment. So the IM is basically saying we're all doing the best we can. There is no pathology, no one's broken, but we're influenced in responding to 4 domains: our home domain, the social domain, which is everything other than the home, the biological domain, and the I see, how I see myself, how I think other people see me. Because these 4 domains interact, a small change can have a big effect. We don't need to change everything. A small change can have an effect through all the other domains. So, Dr. Angela, let me start with you. What small change can you recommend to our listeners based on what we're talking about tonight?
Well, I think we have three categories that we have to think about. You know, I'll start with saying real quickly, when we think about the current state data, especially within the Black community, the data showing that deaths of Black people by suicide has steadily and significantly increased over the past 20 years, as well as other minority groups. So intervention at an early age could be a contributor to decreasing that number, as well as some of the other outcomes that we're seeing in this area of mental health. So I think intervention at an early age as it relates to families and parents being thoughtful about that, thinking about tapping into resources to end the stigma that's associated with mental health. I think the lack of adequate care and services is a major contributor. So I think legislation and things of that nature to move forward with driving sustainable, systematic culture change is vital. We all have work to do in these spaces that fit this conversation around diversity and inclusion. So I think those are some of the key things that would need to be done because everybody has a part to play. So just chipping away at it at one little moment at a time is what we want to think about.
Dr. Simon, small changes. What can you recommend to our listeners?
So small change for listeners, you know, actually take time for yourself. It can be very easy in this society to kind of go, get home, you sleep, you wake up, go. And even a small bit of 1 minute, 2 minute mindfulness where actually, you know, your phone's off, you're not on social media, TV's off, and really trying to like center yourself is something that we all can do, and that doesn't take too much time. A thing that I'm just broadly saying the system can do is make how we engage more pleasant, in so much as a lot of the times the introduction to mental health is very frantic, chaotic, and not pleasant, not pleasant at all. And if we can, I think Dr. Crutchfield, you were mentioning like hospitality, really recognize that we're in the service field. And if we actually treat people how they want to be treated and are hospitable, that actually can also go a rather long way.
That'd be a great small change. We have about a minute left. You control no one, you influence everyone. You get to choose the kind of influence you want to be. Dr. Crutchfield, I'll start with you and then end with you, Dr. Simon. Dr. Angela Crutchfield, what kind of influence do you want to be?
My influence comes from my personal mission statement, which is based on a scripture that says, "Let my tongue be the pen of a ready writer." So for me, that means what I believe, my spiritual perspective, and all that I feel as my core foundation. I want to have influence and impact in a positive way on the lives of other people. And that's how I live my life.
Let me just say you are. You are. I love it. Dr. Simon, you control no one, you influence everyone. What kind of influence do you want to be?
Yeah. So, you know, thinking about the role that I'm in with the city, I think allowing diverse persons to recognize that talking about mental health, thinking about mental health, just even being curious about it is okay. And I see it when I, you know, go to community centers and they're like, "Oh, lo haitian," and I talk Creole with them. So yeah, so who I am, that's who I want to be.
That's great. Folks, thank you so much for the discussion. You can do this.
Stretch the kindness, rush with madness. Is it sadness or just a show?